We have been talking about the epidemiology. It's like a refresher's course. And we talked about some descriptive epidemiology where we are thinking about the time, place, and person to be described in context of the disease or condition. Actually, the situation differs between a clinician and an epidemiologist. Clinician will use the stethoscope, will use the hammer, may use the laboratory tests, may use the radiology tests, and so on. But epidemiologist has to diagnose the community, and that's why for community diagnosis, he may have to deploy some research methods. And these research methods we were talking about. In this research, what we need to do is first of the steps is observation. Observation is a great teacher. It's a great master. One who observes very minutely learns so many things. And let me tell you that actually observational studies is the main component in all the research methodologies. And because of that, the research methodology has two different types of observational studies. One which you already know. This is known as descriptive epidemiology. You'll be surprised that what we were naming as descriptive epidemiology is part of the observational study because basically we are describing and observing who, where, and when. The second part is analytical epidemiology. That's also an observational study because in analytical study either we try to see uh, the ecology, that is the environment in which the factors are present for the disease. So it may be an ecological study where we try to correlate the different variables that cause the disease. Ecology is nothing but the environment, including the human being. The second very common study which is being done as part of the analytical study is the cross-sectional study. Do you recall the prevalence? Prevalence is nothing but the cross-sectional study. In a given time, we try to study a particular situation in the community, which is known as a cross-sectional study. It's an observational study, but it leads to analysis. That's why it is analytic study. The third one is case control study, where we are looking at the case. That means a person who has been either affected or has a risk factor or is exposed to some detriment. Such an individual is a case. The other individual who does not have that negative aspect, neither he is a case nor he is exposed to, such a person may be used as a control. So whatever the difference between these two entities are there, that makes the core of the study. That is known as a case control study. Compared to that, we may have a long time study after observing the people who are not exposed at all, who do not have the risk factors, but we try to find out that in the long run, in these so-called healthy individuals or so-called exposed persons, what is happening? And if the disease comes out or a condition comes out, this is a cohort study. So these four important studies are part of the analytical studies. One is ecological study, which is also known as the correlational study. The second is the cross-sectional study, which is also known as a prevalence study. The third one is a case control study, or maybe known as case reference study. And fourth is a cohort study. So descriptive study and analytical study of these four types, they make the part of the observational studies. When we do not observe but actually do something, in observation we are not doing anything. This is just observing and noting down and analyzing. But if we do something, we intervene in the particular affair, say either providing some nutrient or providing some vaccination, it's an intervention. So whenever there is an experiment on the humankind or the population, that is known as experimental or interventional study. In that, the most common and most important is randomized controlled trial. Here, the individuals who are being studied or the population that is being studied is randomly selected. It's not a choice of bias. It is randomly selected, and the randomization is controlled in a way that there is definitely a bias is all types of errors, observational errors or the selection errors are avoided. That is randomized controlled studies. It is commonly known as RCTs. The second one in the same group, that is known as field studies or field trials. In field trials, we are going to the field and try to understand the environment vis-a-vis the host factors. The third one is again in the field, but it is known as a community trial, where the persons as a group are involved and we try to identify them in the community. So these three studies are interventional studies. We can do intervention either at the individual levels in the cases and controls, which is known as the randomized controlled trials, or we go to the field trials, and also we may go for the community trials where the community interventions are being done. Well, now these classifications do not mean that they are tight compartments. Maybe a descriptive study may immediately follow with the analytical study or may have the RCT as a component. But for the purpose of the classification, we have classified them in different categories. They are not the iron compartments, that they do not mix up with each other. The second part with that in observational study, we allow the nature to act. This is very important. In observational studies, the nature takes its own course and we are just observing. And the first one which we have decided to talk about is the descriptive study, which we will be describing details. Where the second is analytical study. And analytical is related to both. It relates to health conditions or disease conditions, but the ultimate analysis leads us to understand that what is happening actually. And based on that, we can come to certain conclusions. In experimental studies, we are doing active intervention, and this is worth knowing. Say, in descriptive and analytic, we are not doing intervention. Please remember that part, and it will be okay. And because of that, there are limitations, because when we do some intervention, the intervention is on the human beings. It's not on the rabbits or rats. That's why the ethical issues come up. We will have to explain the entire study to the person who is participating as a subject, and then we will definitely tell that certain risks, certain benefits will be available to them, and they need to understand, and then only with their consent they are participating. For example, is a drug trial. What will happen with the drug we do not know in a particular individual. So we need to explain that these are the possibilities of negative or positive point whatsoever they are. And after informed consent only, such a study should be launched. And most of the times the RCTs, randomized controlled studies, are done in the hospital premises also, where the patients are the subjects, and we may have the drug trial or vaccine trial or particular therapy trial. This can be done. Now, when we do all these things, what should we do? There are several steps. One, define the population. Whosoever you want to study as a community, as a group, must be defined. For example, one may decide that he or she will study all the children in the KG class, junior KG and senior KG, into entire Ahmedabad by selecting them randomly. But then one has to adhere to that particular criteria. Another one decides that the study will be conducted in a rural area of Banaskantha district, where the villages of more than 10,000 population will be taken. All villages less than 10,000 population will not be taken. And again, those villages are selected, only women will be taken. Again, in women, only those who are in the reproductive age group, they will be selected. And the randomized 10% sample will be taken from them. Whatever you decide, the population has to be defined. That's one thing. Secondly, once you decide the population, one needs to define the case. Case means who is to be studied. When you say that a woman is to be a subject, which woman? In a reproductive age group, which reproductive age group? 15 to 45, In that 15 to 45, who are the women to be included? Mothers or those who are not mothers? Mothers with one child, two children, whatever is the ultimate objective of the study, you need to identify who is being subjected to the investigation or the study. So there are two things. One is we decide the population and we define accordingly. And then secondly, we decide who is the case. Third one, we need to define the exposed. For example, suppose a communicable disease study is being done. Who are the individuals who are in contact of the COVID-19 case? All those individuals will be studied. They are exposed. They may not become cases or they may become cases. But here the population which has been taken is the exposed persons. Some individuals who are obese, they are also exposed to some risk as far as the cardiovascular condition is concerned or other diabetes mellitus is concerned. But we are very sure that who is being selected for the study. Descriptive epidemiology is on as a whole is a very simple epidemiology. It is best, easy, relatively cheaper, but it happens to be most of the times the first step to study. Once we get some results from the descriptive study, we may go for the higher levels of the study like RCT or so. And so several examples will help. For example, the scientist Edward Jenner, who discovered the smallpox vaccine, he was observing that the shepherds who come to his house for providing the milk, their families are not affected with the smallpox in those days, in the 19th century. He was surprised. And then he started observing them. And he found that most of these shepherds had already been infection of the cowpox because they were milking the cows. And because of that, they had some immunity level which protected them from the smallpox. This sort of observation led him to further invention and he discovered the smallpox vaccine. And we know that smallpox could be eradicated because of that vaccine. So such examples will lead us to understand what is the importance of observation. Similarly, for vitamin C, the study was conducted by James Linde. And in the sheep, he identified that some people have bleeding gums. Why these are happening? Then he tried to treat them with some little intervention, providing the fruits. Those persons who were provided the citrus fruits, having vitamin C inside, they were best treated or they were prevented from having the bleeding gums or the scurvy. Now we know that. Such observations and trials will lead to some understanding of a given condition. Now in descriptive, when we say that when, where and who, these three are also known as time, place and person factors. Once we know that these time, place and person are to be the what time we will be taking. Time may be taken as years. The study may be for a year. Study may be for months. Or the condition is very quickly to be resolved. It may be studied for several days or months. For example, if somebody is studying the pregnancy outcome, it will be at the most 9 months. That study can be taken for 9 months. If somebody is talking only about the post natal period, then that period will also be focusing around several months, 1 month or 1.5 months. So depending upon that, the time period should be observed. Place. Study may be done anywhere, but the place has to be defined. Suppose somebody wants to take in a rural area or urban area, in urban against slum areas or posh areas, in schools, in colleges, whatever is the place. But study time, study place have to be defined. Again, as I told you, who will be the subjects for the study should also be identified. Because when we start study, we need to have some objective. Why do we do the study? Based on that, the time, place and person has to be identified. When you select a person, please check for all the variables of an individual. These variables may be age, sex, occupational status, marital status, educational status, etc. etc. Because when you try to analyze that, you may be able to identify that certain occupations are related to that particular disease or educational status is responsible for so and so outcome. That's why Whenever a subject is selected, as many variables present in that subject should be noted down. We do not know which particular variable will be responsible for giving us the results. That's why all those variables should be taken down. Second thing, when we take the subjects, 5, 10 subjects will not give any result because this may be just a bias. That's why larger the samples, better the result. We say that obese persons have diabetes. Somebody started studying in 10 obese persons there were diabetes. But this is not sufficient. He should have selected some 100, 200, 300 obese people in the randomized way, and then he studies and identifies later on that there was diabetes mellitus development, then it has some relevance. The studies should have larger samples. Later on, when you study the statistics, you will realize that based on each variable, when you generate a table, the table will have so many blanks. Each blank should ideally be having at least 5 to 10 members in that. So in a given age, given sex, and given occupational level, given educational level, taking all together, there has to be minimum 5 to 10 persons. It means that the total numbers will be very large, at least 500, 1000. Whenever there is a community study, this will be required. Second thing is, these studies do not differ much, particularly when you do the case control. Suppose I am doing the study, who are the people who are likely to be infected with diphtheria in the children. Now, I will take only those children who are having diphtheria as the cases. And similar type of the individuals, similar type of the children will be taken who do not have diphtheria or who are away from the diphtheria possibility. But apart from diphtheria, all other variables in these two groups of the children should be similar. Then only you can say that though they were similar in all other matters, the diphtheria happened because of this X, Y, or Z variable. Ultimately, coming to the point, what we are doing by doing all this exercise, we are trying to identify the determinants of the disease. Please remember this D. If you want to remember the disease, then determinant of the disease will be remembered. Determinants will be distributed in the community. For example, a disease is distributed age-wise in the community, diphtheria in the children, or cancers in the old age. Not only that, it will be distributed in the place, say diphtheria in the dense populations, in children. So population is also identified, children is also identified. This is known as the distribution of the determinants. They may be timely distributed also, that certain diseases happen to be only in the monsoon, certain diseases happen to be in summer, certain in the winter. These are very essential points which must be understood. For the purpose of understanding the disease, we need to know determinants. We need to know distribution of the determinants. And later on we will study that we will also need to know the distribution of the determinants and their dynamics, how they behave, how they act, how they really give the results. And third thing, suppose you have already defined population, you have defined the condition which is to be studied, you have defined the subjects which are to be studied. Now, how will you measure them? Suppose you are taking the antenatal mothers. At which particular period of the antenatal periods? Out of 9 months, all 9 months, only last trimester or second trimester, what will you study for? And how will you measure that? Will you measure hemoglobin? Will you measure weight? Will you measure the blood urea? What is your criteria? So the measurement should also be identified. Measurements may be height, weight, whatever it is, but it should be measurable. The third one is, suppose, say we identified it, then the indices will have to be compared. Suppose in the current COVID state, we are studying the COVID deaths. In that case, the deaths in X district may be compared with the deaths in the Y district, provided the population and other things are taken as comparable measures. If you compare the disease in the different districts, the population has to be considered, the age-specific population has to be considered, age-specific deaths have to be considered. So how will you measure? That's a big thing. Particularly, you need to decide about that. Once you measure it, when you compare it, Then the last thing is you generate some hypothesis, your own idea, that based on my results, I would like to say that breastfeeding leads to the better health in the infant because you have observed it. Or based on my own observations, I found that I had studied some 500 infants, those who were given the winning food and those who were not given the winning food. Those who were given the winning nutritious foods, they were healthier compared to those who were not given the nutritious winning food, but they were continued only on the breastfeeding. And what did you measure? You measured the weight, you measured the height, you measured the head circumference, chest circumference. So you decided the population, you decided the case, you decided the controls, you decided the condition which is to be done, to be studied, you decided the measurements, and after doing that, you analyze them and come to a conclusion that this is my hypothesis. This is how the descriptive studies can be taken up. We shall be going into details of other variables and other types of the studies in the lecture to come. Thank you very much.